Let's talk about Carbidopa levodopa. The trade name of this medication is Sinemet. This medication is a dopamine agonist, meaning it increases dopamine in the brain. This medication is used for patients with Parkinson's disease. And in Parkinson's disease, we have a decrease in dopamine and an increase in acetylcholine. Parkinson's disease is a slow-progressing neurological disorder that affects movement. This decrease in dopamine causes symptoms such as tremors. A classic one is the pill-rolling tremor, which is a tremor of the fingers and hands. You can remember this by the memory trick, pill-rolling tremor, think Parkinson's. Other signs and symptoms are rigidity or stiffness, bradykinesia or slowed movements, and postural instability. A classic symptom is a shuffling gait. It's important to know that this medication does not cure Parkinson's. There is currently no cure for this disease, but this medication helps control symptoms, allowing the patient with Parkinson's disease to have an increased balance, decreased tremors, and improved coordination. Normally, levodopa is broken down before it even reaches the brain, but carbidopa prevents the breakdown of levodopa before entering the brain. You can remember this by the memory trick, think carbidopa carries levodopa to the brain. But why is it so important that levodopa reaches the brain? Well, levodopa mimics the action of dopamine in the brain. You can remember this by the memory trick, levodopa, think increase dopamine. And remember, these patients have a decrease in dopamine. So, carbidopa and levodopa enter the brain. This causes an increase in dopamine, which leads to a decrease in Parkinson's symptoms. Let's look at some side effects of carbidopa levodopa. Since this medication is acting primarily in the brain, it will have some central nervous system involvement, like dizziness, drowsiness, headache, hallucinations, and orthostatic hypotension. Orthostatic means relating to posture and position, and hypotension means low blood pressure. Orthostatic hypotension happens when you change positions from lying down or sitting to standing up too quickly. This causes your blood pressure to drop, which leads to an increased risk for falls. So, we want to educate on ways to prevent orthostatic hypotension. Educate your patient to change positions slowly. You want to have them sit on the edge of the bed and dangle their feet 30 to 60 seconds before attempting to stand. Now back to our side effects. This medication can also cause GI upset like nausea and vomiting. Which brings us right to our patient education. We want to educate our patients to take this medication with food. This decreases the risk for GI upset. The full therapeutic effect of this medication may take several months to achieve maximum results. Sweat, saliva, or urine may become a dark color, red, brown, or even black. This is normal while taking this medication. Let's look at some contraindications. Do not take this medication with MAOIs. Carbidopa levodopa plus the antidepressant medication monoamine oxidase inhibitors, or MAOIs, this can cause an increased risk for a hypertensive crisis. Okay, let's review some of the most commonly tested on information for carbidopa levodopa. This medication is used to manage symptoms associated with Parkinson's disease. This medication does not cure the disease, but makes symptoms more manageable. We might see side effects related to the central nervous system, such as dizziness, drowsiness, headache, hallucinations, and orthostatic hypotension. It's also important to remember that sweat, saliva, or urine may become a dark color, red, brown, or even black. This medication should not be administered with MAOIs. If you want more information like this, you can find it in the complete Pharmacology Flashcards. It covers everything you need to know in your pharmacology class, but it's presented in a fun and condensed way, no more textbook fluff. That's all for Carbidopa Levodopa. If you found this video helpful, don't forget to subscribe to my YouTube channel. Happy studying, future nurses!